Thank you very much. And thank you, Rosemary. You've set the scene beautifully for what I'm going to speak to, which is how the pandemic has affected older persons globally. And I just want to say to the audience that this is pertinent to you. The one certain thing is that you will be part of this cohort. And if you're not, you won't be around to know about it. So this is relevant to everyone listening. Since the mid-1800s, we've been living year on year longer, such that each decade, that cohort lives on average 2.5 years longer. And it looks like that trajectory is going to continue into the near future, despite diabetes and obesity, etc. So bear that in mind. This is pertinent to you. The demography is changing dramatically. Already we have seen the number of people globally over the age of 65 outstrip those under the age of 5. And I want to kind of reflect in the context of marginalization on when we first got some signals that this was important for the older persons, and then when we started to maybe pay even slight attention to those warning signals. And way back in early January, there was a detailed report from the Chinese Center of Disease Control, and it clearly highlighted that older age was the most significant risk factor for severe complications and death from COVID. Now, at that stage, of course, COVID was in its infancy in Europe, in the US, and in Canada. Roll on to the end of March, for example, in Spain, and I'm going to give you a couple of case scenarios to set the context of how we have addressed marginalization in our older citizens. End of March, the army were called in to a nursing home in Madrid to disinfect the nursing home. And there they found abandoned dead bodies in beds of residents. Many of you will recall this atrocious circumstance. Now, this was home for these residents. Some had been there for 6 years and longer. So that was Madrid. That was end of March, 3 months after we got the first signals from the Chinese. In late April in Montreal, again, authorities were called in to a residence where they found residents, patients, left soiled, unfed, dehydrated. There had been 31 deaths there in the previous 2 to 3 weeks, and the caregivers had fled. They were frightened, they were overwhelmed by work. They had left the residence. Another atrocious example in this day and age of attitudes towards that particular sector. It took until the 29th of April in the US for official systematic recording of deaths in the nursing home sector. Globally, somewhere in the region of 45 to 60% of all deaths in relation to COVID have been in the nursing home sector. And in Ireland, our figure is 54% at the moment. The US isn't the only country which hadn't actually documented COVID deaths in the nursing home sector from get-go. This was the case also in the UK and in Ireland and in many European countries. The LSE wrote recently that reporting of deaths in England are inadequate and likely to give false assurance that numbers are significantly lower than reality. And we can ask ourselves, why? Why was it deemed acceptable that that particular cohort should not be documented with respect to the pandemic? To take a step back and try and understand, why do people go into nursing homes? Why will we maybe go into a nursing home someday or require that level of care? 4 to 5% of people over 65 in the US and in Ireland and in many other countries are in a nursing home sector or a significant assisted care home sector requiring significant care. That's 1.5 million people in the US and almost 30,000 people in Ireland, in the Republic of Ireland. And the reasons are that people acquire multiple comorbidities, either physical or mental. So diseases such as heart disease, dementia, of course, strokes, falls, fractures, and those diseases or disorders disable people, so that generally speaking, residents in nursing homes aren't able to maybe prepare meals, or in some cases eat independently, feed themselves independently, bath, dress, toilet, manage medications, or mobilize without assistance. That's why people require that level of care. It's really unusual for someone to volunteer or to request to go into a nursing home care. And in 35 years of clinical practice in medical gerontology, I've had 2 patients who requested to go into a nursing home who I didn't think required that level of care, but they were lonely and perceived that they required that level of social engagement. Very unusual. So because of the complex comorbidities, these are a skilled nursing workforce, or certainly healthcare workforce, and yet they're probably the worst paid in our healthcare system, and certainly one of the least valued. And that was unmasked by this pandemic, where lowly paid healthcare workers had opportunities to get better pay elsewhere, like in supermarkets. And that was one of the issues in Ireland, that many actually moved into other sectors for better resource when they could. Why did we get this issue? Well, first of all, the infrastructure in many of the facilities wasn't appropriate for infection control, and there was no planning in advance, many months in advance, as there was in the acute care sector, to ensure that there was appropriate infection control. So without rigorous infection control, you had in many cases migrant workers who were living in clusters, coming into the nursing home, maybe infected with COVID. No screening was taking place on time, no proper PPE, etc. Patients much iller, requiring more intensive nursing care skills, which weren't available. Many of these homes are in the private sector, so there wasn't absolute clear clinical governance. It was happening on a wide scale. And once screening started, then it became apparent who was and wasn't infected, or who had been in contact. That further significantly reduced staff numbers, and of course the reduction in staff numbers, even in contacts, meant that it was very difficult to look after now iller patients. So it was a catastrophe awaiting to happen. And as Rosemary has said, it really unmasked the fragility of this whole sector. It was borderline to begin with. So that was coupled then with lockdown. So the solution was, we'll lock everything down, and bar relatives, siblings, spouses, often older themselves, children, etc., from visiting. And this has been the case now for over 8 weeks in some nursing home facilities. And some of the residents are not fluent with technology. We're using technology for today, but many of these residents are not fluent. So they're dependent on care staff for short windows of opportunity to engage with their loved ones. And that's very hard-pressed, busy, overstretched care staff. So that doesn't often happen. And then that's compounded by guilt, anguish, and worry, which is felt by their loved ones, and poor communication, because when you're really busy, you don't have time to answer the phone all of the times and engage and communicate. So the hard-pressed staff have not been able to rise to the challenge of this very fragile infrastructure. Monique Pelletier, who's a former Minister for Women, I think put it really well in a recent op-ed in Le Monde, where she criticised the incomprehensible and inhumane way that residents in some retreat homes were being treated. It's taken hundreds of deaths in France for persons who have died from COVID in these establishments, before people in France woke up to show some interest in those rest homes. So our constitution is very clear. We're held equal before the law. This means that the state cannot unjustly, unreasonably, or arbitrarily discriminate between citizens. We can't be treated as inferior or superior based on ethnicity, race, social, and religious backgrounds. The Constitution specifically recognizes the right to life. Your right to life means the right to have nature take its course and to die a natural death, but it does not mean the right to have life terminated or death accelerated. So why has this happened? Why have we enabled this in our society? And I put it to you that we're very ageist and we're fearful ourselves of aging. And because of our fear, we block out the possibility that I started with. We're all going, this is going to happen to everybody. This is our responsibility for ourselves. Ageism is stereotypes, prejudices, discrimination towards people based on age. It's the commonest ism. 1 in 3 people in Europe experience ageism. And we see it all the time in cultural, in our institutions, on a personal level, etc. And the problem is, and this has happened with this pandemic, people and our children in our society will internalize ageism. They'll internalize negative perceptions of what has happened through media, etc. And we know from a research perspective, that actually shortens our lifespan by 7 years. If you have negative perceptions of how you're aging, you will live 7 years less than a person who's got a positive attitude to aging and positive perceptions of how they age. However, I too want to end on a more positive note, because I think this has unmasked ageism at society and at policy level and indeed within individuals, and particularly within our media. But this was previously an invisible sector, and it was really hard to get visibility in this sector. We now have an opportunity for change. This pandemic, it's very likely we will experience more, and this is the cohort, and as other marginalised groups are, who will most be subject to severe consequences from these. So we need more research to identify what's the best policy and practice for individual countries. We need much better education across all sectors. Our education and training with respect to aging is poor in our third level institutions. And this is an opportunity now to reflect on that. And to ensure that the rights of citizens to feel equal in our society are met, whatever their needs. And I was very glad to end on a note, even more positive note, that the Taoiseach, who is himself a medical physician and who's doing a session a week on the front line, stated on Friday night that we will review our entire care sector, from housing through to nursing home care, and our policy with respect to the ageing sector in Ireland. And that's very welcome, and frankly, it can't come quickly enough. Thank you.